Let's chat about alcohol intoxication when someone can't think clearly or function properly after having a drink. It's interesting because even one
Definitely.
drink can start that process.
Right. So it's not just about being tipsy. It's more like your brain and body just slow down because of the alcohol in your system.
Exactly. The key point is that legal intoxication is measured by blood alcohol concentration, or BAC. Typically, a BAC of 80 to 100 micromolar DL or higher gets you legally impaired. But of course, the
Yeah,
actual
really
feeling of
interesting.
impairment can vary so much from person to person.
Absolutely. And that's because factors like age, gender, weight, and even how often you drink play a major role.
It's like no two bodies process alcohol the same way. And then there's the whole twist with binge drinking. 4 drinks for women and 5 for men in one go can really tip you over.
True. And if you add in mixing with drugs or certain medications, things can get even more dangerous.
Right. The symptoms can start off mild, feeling relaxed or a bit sleepy, but then escalate pretty fast. You could move from mild coordination issues to, well, severe symptoms like confusion, vomiting, and even
True, that
coma.
escalation is scary. When it comes to diagnosis, it's mostly about the history, physical exam, and if necessary, a blood test to check your BAC, right?
Exactly. And they also check for the smell of alcohol on your breath. It's all about piecing together the puzzle of what happened.
Makes sense. Now let me ask, do you think everyone should be so cautious, or how do these guidelines really help people manage their risk?
Well, I do think these instructions are crucial. They remind folks not to drink if their doctor says so, or if they're pregnant or underage, and to never drive after drinking. It's all about
Yeah,
keeping
safety
everyone
first.
safe. But I sometimes wonder if these rules might be too strict for social drinkers who know their limits.
That's a fair point. It really depends on individual tolerance and circumstances, doesn't it?
Exactly. And that's why they also stress hydration, not drinking on an empty stomach and spacing out drinks. 1 drink per hour is a good rule of thumb.
Definitely a solid strategy. And then there's the important note. If someone seems dangerously intoxicated with severe coordination issues, vomiting bright red blood, or even thoughts of self-harm, you need to get help immediately.
Right. It's not just about legal or physical impairment, it's also about mental health. They advise calling 911 or reaching out to crisis lines if there's any thought of harming oneself or others.
For sure, that could save a life. So, in summary, alcohol intoxication is a serious condition, and while moderate drinking might be okay for some, there's a lot happening under the surface that can spiral quickly.
Yes, exactly. It all comes down to understanding your own limits and the risks involved. Talk to your healthcare provider if you're ever unsure.
Right on? Great chat. It really drives home how important it is to drink responsibly and know the warning signs.
Absolutely. Being informed is the best way to stay safe.